Do a florist, head to toe assessment, room scan. Okay. I have gathered my supplies.
Come in.
Hello, good evening. My name is Diego Flores. I'm a Kilgore College nursing student. Can I please get your name and date of birth?
Oliver Tidwell, September 1st, 2000.
Do you have any allergies?
None.
Alright, so what I'm here doing today is a head to toe assessment. Do you have any questions?
I don't.
So for the first part of this assessment, you're seated in the proper position. And can you smile for me? Can you frown? Can you puff out your cheeks and raise your eyebrows? Okay. And do you know where you're at?
I'm at Kilgore College.
Do you know what day of the week it is?
It is Monday.
And who is the president?
Donald Trump.
Okay. And do you have any issues with hygiene?
I know.
Do you shower every day?
I do.
Do you have running water?
I do.
Alright, and tell me what your nutrition on a day-to-day basis is.
I always make sure that I get a lot of protein, I eat my fruits and vegetables, and I drink water with every meal.
Okay. And do you mind if I take your vitals?
Yeah, go ahead.
Alright. Do you have any pain today? And if you do, what would you rate your pain from 0 to 10, with 0 being no pain and 10 being the worst imaginable pain?
I have no pain, so 0.
0 pain? Okay. And can I get your height and weight?
6 foot, 200 pounds.
6 foot, 200 pounds. Oxygen saturation is 98%. Temporal temperature is 98.6 degrees Fahrenheit. And let me see your wrist, please. Okay. So your heart rate is 80 beats per minute, regular rhythm with a +2 amplitude, and your respirations are 16 breaths per minute, non-labor with normal depth, with equal rise and fall of the chest on inspiration and expiration. I have sanitized my stethoscope. Your blood pressure is 122 over 78. Okay. I asked for your height and weight, right?
You did.
Sorry, I did just interrupt you. I asked height and weight, I did temperature, I did heart rate, but respiration.
You're doing a good job so far.
Okay. Yeah, sorry, I did just threw me out. Alright. So now with the oxygen gloves on, do you mind if I inspect your head?
Go ahead.
Can you look down? Do you mind if I touch your head?
No, I don't mind.
Alright. Tell me if you have any pain.
I don't.
Alright, look up. Any pain?
None.
Tenderness?
None.
Alright. Now just tell me when you see the pen.
I see it. I see it.
Okay, now follow the pen. Okay, put your eyes down. Okay, look at me. Take your hand back. Look at me. Okay, can you move a little this way, please? Alright. I'm gonna whisper 3 words into your ear, cover your other ear, and just tell me what they are.
Round table chair.
Alright, cover your other ear. Same thing.
Wall green light.
Alright, cool. Can you look up real quick? Alright, can you cover one side of your nose? Breathe in and out. Other side, in and out. Alright. Stick your mouth, open. Say ah, wide. Stick out your tongue, move it side to side. Alright. And look left. Look up. Okay, now look to your right. Any pain?
None.
Okay. Now look down, up, down and round. Okay. And now the next thing you're going to do is something called protraction. You're going to stick your neck out, come back. All right. Any discomfort?
None.
Okay. Now just shrug your shoulders. All right. So I'm going to doff my gloves, and this next part of the assessment will be done with the client's shirt off, but due to the video and the privacy of the client will keep his shirt off. Can you turn around so your back is facing the counter. And have you had a cough recently?
None.
Okay. Now, when I place a stethoscope on your back, just breathe in and out.
Okay.
Raise your right arm. Raise your left arm. Okay. Now can you turn around so that I can see it? I'm gonna palpate your chest. Let me know if you feel any pain or tenderness.
No pain or tenderness.
Awesome. Same thing. Okay. Now I'm listening to your heart sound.
Okay.
And you say you haven't had a cough, have you?
I haven't.
All right, can you please lay down?
Yeah.
And, what was the last time you had a bowel movement?
That's gonna be this morning.
Okay, do you have any issues passing bowels or anything in your bladder?
None at all.
Let me know if you feel any pain.
I will.
Okay, everything good?
Everything good.
All right, can you sit back down on the chair, please? And can you extend your arms out? Okay. Good. Now squeeze my fingers. Squeeze, squeeze, squeeze. Let go. Turn your hands around. Okay. Now using your thumb, can you touch all your finger individually? Awesome. Okay. Now let me inspect your feet. And is there any reason you can't put your feet in the stool?
No reason.
In the stool? Put your legs out. Put some assistance on your feet. Flex your feet to your shins. Down. All right. Now using your right heel, go down your left shin. Same side. All right. And do you use any assistive devices to help you ambulate?
No.
Stand up, please. All right. Now just follow along, please. Watch it. It's fine. Okay. Now can you stand right here? And can you take 3-4 steps this way? And stop. Reach down and touch your toes safely. Okay. You can sit back down. All right, so that concludes our assessment. Do you have any questions?
I don't.
All right, so I'll make sure you're gonna sit in a comfortable position. This is the call light. Let
Okay.
us know if you need anything, and I'll go document my findings to the provider.
Okay.
So, my client is alert orientated ×4. His facial expressions are symmetrical, and his hygiene is well groomed. He has no issues with showering. Client is well nourished. He has no issues with nutrition. Client's speech is clear. Client's hearing is clear. Client's mood and affect is calm and cooperative. Client's skin is appropriate for ethnicity. Okay, so on inspection of the scalp, there was no lesions or abnormalities noted. On palpation, it was warm and dry with even hair distribution noted in the head.
Inspection of the eyes, the sclera is white, the conjunctiva is pink, the peripheral carnal fields and perla is intact. On the hearing test, on inspection of the ears, the ears are free of any lesions, tenderness, or any pain with no drainage noted. The whisper test is 3x3 bilaterally and it's symmetrical. Inspection of the nose is midline, and the neuropathy test is symmetrical. And on inspection of the mouth, the mucosal membranes are pink, the mouth is moist, and the client's able to stick out their tongue and move it around. Inspection of the neck, the trachea is midline. The carotid artery pulse is regular rhythm with a +2 amplitude. There are no palpable lymph nodes and no jugular vein distension noted. Client has full range of motion and is able to protract and retract. On inspection of the anterior posterior chest, there was no abnormalities noted, and on palpation of the anterior chest, the client denies any pain, tenderness, or pain in the chest. The lungs are clear to auscultation in the posterior, lateral, and anterior with no adventitious lung sounds noted. Client denies a cough. Client's pulse of maximal impulse is present with a regular rhythm and a +2 amplitude. Client has S1 and S2 noted in all 5 cardiac landmarks with no extra heart sounds, murmurs, or gallops noted. Client says his last bowel movement was this morning and has no issues passing bowels or emptying the bladder. On inspection of the abdomen, there is no distended noted, and on auscultation, the client has normal active bowel sounds 20 per minute. Tympany is heard on percussion at all 4 quadrants, and the abdomen to palpation is soft and it is not rigid. When I was inspecting the client's upper and lower extremities, the skin is intact. The skin is warm and dry to palpation, it's warm, and there's even hair distribution noted in the upper and lower extremities. The nails are pink, intact, and have a capillary refill test of under 3 seconds in all fingers and toes with no abnormalities noted between the toes. There is no pretibial edema in the toes, no in the feet, in the lower extremities, and no abnormal temperatures noted in the upper and lower extremities. On palpation of the radial, popliteal, posterior tibial, and dorsalis pedis, all pulses were present with a regular rhythm and +2 amplitude. Client's coordination in the upper and lower extremities is intact. Client has equal grip strength in the upper extremities, and the client is able to plantar and dorsiflex upon resistance or on resistance. Client denies the use of any mobility devices. Client denies he has any issues with posture while he's sitting and standing. While the client was standing, he was able to perform all full range of motions with the upper and lower extremities. And client's gait is coordinated and balanced with no abnormalities noted. Client was able to reach his toes, and on inspection of the spine is midline and intact with no lateral curvature. Thank you.